going back to the discharge requirement. Yeah, that's fine. That's not a problem. I've got quite a few from people who do actually work in the private sector as well of healthcare, and it says one of them is it acceptable for some private PTS ambulance to be turned away from certain NHS trust ambulance stations for cleaning procedures after each transfer? Because actually it is documented that they should be cleaned after each transfer.
Yes.
And they have been turned away. There's another thing I'm getting. There seems to be a little bit of a ridge going between private and NHS. And the private people are starting to get a little bit narked about it from what I see. I don't know how or how it's developed, but from what I'm getting and what I'm receiving from people is literally like, no, you're private, you can't have this and you can't have that. Where the private are like, no, we're helping you. We're trying to alleviate some of your, we've been brought in to alleviate the amount of patients that you have, where it's transferring patients.
Absolutely. Actually, I've been enormously impressed in everything I've seen of the way the private healthcare sector has risen to the challenge to support, essentially become part of the NHS throughout this crisis. And I'm very happy if you want to send me the details of the cleaning station that this is happening at, to follow that up with the ambulance service and with the healthcare trust to see if we can get it resolved.
Okay. It's an interesting thing that, from a point of view working in the NHS, I can understand why there is a ridge, because allowing the private sector to take over where the NHS should have sufficient services to do so. But then again, we are in a crisis, so that's where these private ambulances and other care homes and stuff comes into it.
The private sector is being used extensively throughout this crisis. Essentially, the NHS has bought in all of their services. Now, in parts, there are private hospitals, like the one down in Missenden, that are providing some of the specialist cancer care. Others are playing their part as part of the main COVID response. And it certainly shouldn't be the case that any private sector provider that is doing their bit as part of the response to COVID-19 should be being treated in an unfair manner. So again, if you can send me the details, either anonymised or if with the consent of the person raising it with their details, I will happily take up each and every issue, or if they're not from my constituency, ensure that the Member of Parliament that represents them takes that up.
I'll give you a little story, which was Domino's are given I think apparently £100 million worth of pizza to all NHS professionals, and so they deliver it to obviously wherever they are in the hospital, to certain departments. And one of the private guys was like, "Oh, can I have a slice?" And they said, "No, you're not NHS." And that, it was like, whoa, that's a little bit, It was a bit like they're transporting, they're doing their thing, Again, they may not be NHS, but they are actually on the front line as well. I mean, that story just made me laugh when they said it. I was a bit like, well, first of all, the person had noticed, obviously, that they're not NHS ambulances or staff. And then, obviously to follow up with that, I was a bit like, we're in this together. Surely a slice of pizza wouldn't really matter. So, but that's what I mean about the ridge. That's what I mean about the ridge. It's a bit like, it shouldn't happen, but it does. And certain things, the private people in care homes and looking after in the social setting and everything, they do feel they're not getting appreciated. They do think when, for instance, the clap for the NHS isn't a clap for them. They feel that they're totally ignored and nothing is for them.
That's actually sad, very sad to hear. Actually, I'm always very clear when I publicise the Thursday night clap that it's the clap for carers. It's not just a clap for the NHS. Of course, the NHS are an incredibly big part of that, but actually, it's all of our carers. It's a clap for everybody on the front line combating this terrible virus, and it is as much about our social workers as our care home staff, public sector or private sector. who are looking after people in this time. It's as much about our police officers and our firefighters and a lot of people who work for our councils who are on the front line. There's the supermarket workers we were talking about a few moments ago, the farmers who are ensuring that food is actually making it into the distribution chain in the first place, the guys and girls that are driving the HGVs to get the supplies around the country, our armed forces who are doing so much on the PPE distribution effort. Actually, who we're actually clapping for, yes, it is a massive part of the NHS, but it's actually everybody that's doing so much as part of the national effort.
So I was about to have a coughing fit then.
That's right.
I said this first time, to thank everyone when I first started doing some of these broadcasts. Thank you to all the key workers, especially people who are, who we might not think about, people working, at the supermarkets as well. What you're all doing is definitely helping, and allowing us to carry on. I mean, takes you another thing about people complaining about, I'm stuck inside. It's, why? I want to get out. And it's a bit like, well, all you've really got to do. I mean, I'm really busy. I'll tell another little story, and hopefully not bore you. Which was last week, and I'll own up. Last week I was so sorting things out, getting there. I totally forgot about the time. I usually set some, things up on social media to say, clap for the NHS and key workers. Totally forgot about all that. Totally lost track of time. I literally was like 4 hours out of my life. And then the next thing, but what was really nice about it was I heard the clapping. And I was like, whoa! My brain literally just switched on. I was straight outside, banging wherever I had out there, which is nice as well. It means a lot of noises going out there. A lot of people clapping. So to me, it's a bad story for me for not actually being switched on enough there, but also a good one because even though I did not so much forget, I got totally lost in time. The amount of noise out there, thanking everybody and their support is amazing. But then it throws it back to all you've got to do is stay inside. That's all anybody's asking you. All these other people who are out there and who have to go to work, totally understand you don't want to be inside, but you're not putting if you go out, you're naturally going to put yourself at risk. And if and all everybody's asking, and if you go outside and you're clapping, then why are you going out walking about? Why are you doing that? I know fair enough for exercise, but if you've just had enough, you just want to get out and about. It does throw it around a little bit, doesn't it? It's a bit like, well, you're contradicting yourself. If you're out there clapping, thank you NHS, and then all of a sudden you're going to go and see your mate around the corner for a barbecue. That clap means nothing.
That's not on, no. That is not on. I mean, of course, the clap is meant to be done on people's doorsteps or from their front windows.
I do it in the back garden because there's more people who can see.
Okay, fair enough.
And so I can make enough noise as well. I mean, there's only about 4 of us. And to be fair, I do think this, especially with the way, obviously, houses are put across. The front door, I mean, as much as it's nice and depending on where you live, could actually put you within that 2 metre rule. So it's a bit like...
Yeah, that's
so it's a bit... and also I've got a lot more things to bang around in the back garden and make a lot more noise as well. So I'll just quickly go through some of these questions then. I'm getting people messaging me in. That's what you might hear all the dingings all about. I got one question just comes straight through. It says, ask him why don't ward staff from ambulance control centres of that a patient has had COVID. This leaves PTS crews vulnerable. Oh right, why doesn't the ambulance control centre inform when a patient has had COVID? Sometimes they're not getting told.
I can follow that up. It's my understanding that if someone is being taken to hospital as a result of COVID symptoms, then the ambulance staff should certainly be told that.
Yeah.
Or is the question if someone has already had COVID-19, has been confirmed as having had it, and is now got something else that's worrying?
Yeah, I mean, again, I'm this is one of those keep it quiet scenarios. They're messaging me. They're not obviously putting it up on there, so they're probably hopefully they're if I open it up. Yeah, it just says it leaves PTS crews vulnerable. So yeah, I'm sure they'll come back on that, or anything. I can pass that along to you anyway. That question. So also another question: why have certain ambulance trusts not informed private ambulance companies about updates? Now, what this is to do with is I've told them certain things. I said it a little bit earlier. People were going on saying to me about certain things. I said, well, that's to do with the hospital discharge, the service requirement. And they're like, don't know what we talk about. Don't know, never even heard of it. So I said it to them. They go, I've never seen this. Things about, I've trawled through the government sites, looked up certain information, trying to fit everything in and try and look at it from all sides, points of view, and try and steer people in the right way and pass on the information where required. Because some people have asked questions for you, and I'm like, no, that's this. You need to look at that. That answers that question on paragraph 7 or whatever, page 6. Being like your secretary, but yeah, they're not getting the information, and this also stretches to the private sector. A few of the times I've had to pass on the documents and say, well, it's actually on the government website. It's on the NHS England as well. It is actually there, but they're not. It's not flowing through the channels. Certain procedures, certain aftercare requirements. That's something you can obviously pass on. I don't expect.
Okay, so what I'm hearing here, actually, from a previous question as well, is that ambulances in the private sector that are supporting the NHS at this time are not being treated as equals and are not getting the information that they need, and that is something I will happily take up with Buckinghamshire Healthcare Trust.
Yeah, okay. I'll probably send you some of these questions. Well, I will send you these questions, so at least you know them.
Yep.
I just want to go through. Do private care homes still need to enforce? Oh, this is care homes. This one. Do private care homes still need to enforce care assistants to stay at the place of work for a minimum of 7 days after a suspected case of COVID-19?
My understanding of the guidance is that you should self-isolate at home if you think you have been exposed or have symptoms of COVID-19, not self-isolate in your place of work. Now, that I accept there is a grey area if you are a live-in carer somewhere.
I think the question is if somebody becomes ill at the care home, they've been told they have to stay working for 7 days. They're not allowing people in or out.
Is that a specific care home or something that you've heard across the sector?
This is a question.
Because my understanding is that if you show any symptoms of COVID-19, the new persistent cough, the high temperature in particular, then you should self-isolate at your home. 7 days if you live alone, 14 days if you're got a partner, or kids, or whatever it might be.
But if somebody at the care home has it, they're actually saying that they've been told they have to stay for 7 days.
So if a resident of the care home has COVID-19, I will seek to get clarity on that. Clearly it is. What I would hope is that all staff within that care home have got the necessary equipment to protect themselves, so that those within it that do have COVID-19 don't pass it on to them. But that is a very, very difficult situation, and I can understand how scary that must be for the people working within those care home environments.
Yeah, because they've got families, and then they're like, what you mean I can't go home? And I hear this from partners of the people who go to these as well. They're quite worried, obviously, for their other halves. So
of course,
it is a scary thought. But again, we can come back with that next time if that's okay. It says, why can't all ambulance services use uniform guidelines for safe working practices? I don't understand that question. It just came to me. Somebody sent that to me. I need to follow that up, really. I think what they're saying is that nobody seems to have the same guideline on everything. Each different area so I think this must have come from an ambulance guy or girl, seem to have different practices. Why isn't it uniform in all areas?
Well, ambulance, like hospitals, the ambulance service is not a national service. It is a one that is delivered, yes, through the NHS, but by different trusts, and so the trusts are free to, within limits, set slightly different guidelines to certain practices of the way their staff operate. Certainly when it comes to COVID-19, there is very clear guidance from central government that everybody should be following, and if that's not the case, then if it's in Buckinghamshire, I certainly can take that up, and if it's outside of Buckinghamshire, I would urge whoever is concerned to raise that with their own Member of Parliament, or indeed direct to their own healthcare trust, ambulance trust.
Okay. I want to move on to our other questions for other reasons.
Yeah, go for it.
But there's one I really want to... there's actually two here.
Go on.
I will send you a list of these, but because I'm worried about time. I don't like to take up more than an hour of your time, because it's so greatly appreciated that you do this. Would local and regional governments be willing to discuss with care home suppliers, be willing to honour full pay instead of paid statutory sick pay? So if they get COVID, it seems to be they're getting put on SSP, which is, I think, it's unfair.
What I didn't get in that question was your reference to local government, because local government at the moment local government are some of the best payers in the country for the services they're receiving at the moment. So I know Buckinghamshire Council are paying all of their suppliers in full, whether they're delivering a service or not at the moment. So local government is actually a very good payer for services at the moment. I guess there may well be a question within the private sector there, and I guess it depends on whether someone is on a contract or is agency staff, or however their circumstances are engaged to work for that care home. What the government did do, of course, was bring statutory sick pay in for day one if you have symptoms of COVID-19, which certainly wouldn't have been the case prior to this outbreak. I know it is a very, very difficult time for a lot of people, but it's certainly the case that the government is very clear that they will stand by everyone that does the right thing. And if you've got the symptoms of COVID-19, you should absolutely go and self-isolate at home for 7 days if you live on your own, 14 days if you're part of a wider household. And the government has been very clear that it will stand by everybody that does the right thing.
Yeah, and pay them their normal wage, just not SSP. Okay. This is an interesting one. It literally came in. It was the cost of gloves has shot up since the crisis, and private care homes are paying the price. Prices used to be £3.50, but have now shot up to £7. And I checked myself today on Amazon, and I've bought these gloves for the work that I might do on my camper van. That is going to be a roving studio, by the way, for people to know. I wear them, and it was like they were like £3.99, £2.99, something like that for 100. It's now I can't find anything less than £10.
Yeah, there has been profiteering. There has definitely been profiteering.
That's Amazon.
There's definitely been profiteering. I'm not going to endorse that level of profiteering. Although I've fallen victim to it as well. If I can find it in my desk here, this tiny little bottle of hand sanitizer I bought the other day. I suppose it would normally be about 50p in good times. That cost me £3, and it's what? 60 mils. But I wanted it, so I got it. I don't endorse in any way profiteering in this. When it comes to PPE provision, of course, the government have now put in place. It's been in place a couple of weeks now. That's involving the armed forces. That's involving the LRFs, the local resilience forums across the country, being able to source PPE very much on a just-in-time basis at the moment, but to keep people stocked up, which includes the private care home sector. So they should be able to source their PPE through the government scheme rather than relying on
I did ask them,
other sources.
Aren't they trying to source it through, for instance, government-led operatives? And they said they're not in charge of purchases, but they usually buy them from Amazon. So, I mean, I will feed that back.
But they are classed as on the front line and will be able to go through the government scheme to get the national logistic operation that the armed forces are involved in, to get PPE through that means. There are also, not necessarily on glove manufacturer, but there are lots of local businesses who are supplying PPE. I know a lot of our gin distilleries locally have turned their hand to producing hand sanitizer. Honest, I know that's one brand that I've seen doing that. And actually, you and I have spoken in the past about how we're both big Formula One fans.
Oh, yes.
Mercedes AMG. Well, absolutely, that was tragic. But Mercedes AMG F1 up in Brackley delivered 700 visors to Buckinghamshire Healthcare Trust today. So other businesses as well are producing elements of PPE into these settings, and so I would urge everyone's got to do everything they can to get the stocks they need, but they are entitled to the government scheme, and I would urge them also to reach out to those local businesses that, be it through 3D printing or their own expertises, are producing PPE equipment for the front line.
All right. Again, yeah, it's good. It's good that you mentioned that about all the other people who are trying to help. I mean, there has been, I have noticed on obviously the news today, people saying that the government hasn't been able to utilise some of the stocks that people do have, which is a shame. And they've said that, you know, the organisation has been pretty poor in their sort of idea, and then the government's come back with other things saying, you know, sometimes they're not credible people. They've only just set up in the last 2 weeks to try and make their money out of this. But there is a lot of companies out there who.
I think there's two things to say here. Number one, the government have arranged for the delivery of over 1 billion pieces of PPE over the course of this outbreak. Of course, everyone can always say, well, there needs to be more, there needs to be more. Of course there needs to be more. And the government is absolutely working as fast as it can to get every reliable, credible source of PPE into the logistics chain to get it out to the front line. Will there have been some businesses that couldn't produce to the specification required? Probably. Are there some businesses that have offered but haven't quite had orders made yet? Clearly, because people are saying that has happened. And I would say that anyone that can produce PPE to the required standard, keep at it. If the government hasn't got back to you yet, or get onto your MP and we can work out why the logistics haven't added up yet, and make sure that company can play its full part in this crisis.
Okay, good to hear. Right, okay, now